Welcome to Crazy Nurse RN Hub, where learning becomes a tradition. Come, join me as we explore the multifaceted worlds of nursing. Hi there, students, and welcome to Crazy Nurse RN Hub, where learning becomes a tradition. In continuation to our topics on drugs affecting the cardiovascular system, we have drugs affecting the blood coagulation. First, let's have the drugs classification. Under your drugs affecting blood coagulation. First, we have your antiplatelet agents. Then we have anticoagulants. We also have thrombolytic agents, antihemophilic agents, and hemostatic agents. First, let's discuss about blood coagulation. It is a complex process that involves 3 steps. First, vasoconstriction. Then we have the platelet aggregation. Then the third process or step is your cascade of clotting factors. So whenever your patient has an injury or damage to the skin, so these 3 processes would be initiated. Next, we have your disorders affecting blood coagulation. First, we have your thromboembolic disorders. Also, we have your hemorrhagic disorders. For your thromboembolic disorders, these are medical conditions that involve the formation of thrombi. So let's discuss what is thrombi or thrombus. Thrombi and thrombus are the clots that stays in a particular area. However, when we say embolus or emboli, that means these are clots that travel throughout the body, through the bloodstream. We also have your hemorrhagic disorders. It is lack of efficient clotting that can lead to excessive blood loss. So basically, when we say hemorrhagic disorders, this means that there is an excessive or massive blood loss. We also have your antiplatelet agents. Decrease the formation of the platelet plug by decreasing the responsiveness of the platelets to stimuli. So we all know that platelets are responsible for the clotting mechanism of our blood. So when we say antiplatelet, that means we inhibit the clotting mechanism of your platelets. So the patient is prone to bleed. Examples of your antiplatelet agents are abcicimab or Reopro, cilostazol or Pletal, aspirin, clopidogrel or your Plavix, and ticlopidine. So these are the examples of your antiplatelet agents. We also have the therapeutic actions and indications of your antiplatelet. It inhibits the platelet adhesion and aggregation by blocking receptor sites on the platelet membrane. For the contraindications and cautions, we have presence of allergy, surgery if the patient will undergo to a surgical procedure, for example. So we will not give antiplatelet because it could predispose our patient to bleed after surgery or during surgery. We also have bleeding disorders, so we will not give this medication if the patient has bleeding disorders. Closed head injury, stroke, especially for hemorrhagic stroke, so we will not give this medication. We also have pregnancy, lactation, and thrombocytopenia. By the way, the other term for platelets is thrombocytes, okay? So when we say thrombocytopenia, that means there is a decrease of thrombocytes in the body. Thrombocytes, thrombo Cytopenia means that means it's thrombocytes. That means it refers to platelets. When we say penia, that means decrease or less. Okay, so thrombocytopenia means decreased platelet count. We also have adverse effects. First, we have your headache, dizziness. Patient might experience weakness, nausea, gastrointestinal distress, skin rash. So these are the possible adverse effects that your patient would experience if he or she takes antiplatelet agents or medications. Now let's proceed to your anticoagulants. These are drugs that interfere with the normal coagulation process by interfering with the clotting cascade and thrombi formation. So examples are your fondaparinux aristra, heparin, warfarin comadin, dabigatran pradaxa, rivaroxaban Xarelto, apixaban eliquis. So may I just emphasize the two most common anticoagulants? We have your heparin and warfarin. So if you have heparin overdose, so the antidote for that is protamine sulfate. Okay? And also if you have an overdose of warfarin, you will have an antidote of vitamin K. So we have a technique developed here in order for us to really have familiarize with the antidote of each medication. So remember, heparin starts with letter H, so we can associate that with heaven. So we could say, if you are in heaven, there is peace. Okay, so the peace there, which starts from letter P, denotes that it's protamine sulfate. So P for peace, which means protamine sulfate. In your heparin, as we could see, the first letter of your warfarin is W. That means we could associate this with a statement: if there's war, there is killing. Okay, so the killing there starts with letter K, so we could immediately associate that letter K to vitamin K. Okay, so that is how easy we could associate things in order for us to remember some concepts in our discussion. Therapeutic actions and indications. So it interferes with the normal cascade of events involved in the clotting factors. So that means your anticoagulants inhibits the further development of the clotting factors, but the clot which was developed originally will not be reduced. Okay, it will just stay as it is. However, this medication, as what I have mentioned, could inhibit the further formation of that clot. We also have the contraindications and cautions for this medication. First, presence of allergy, hemorrhagic disorders, gastrointestinal ulcers. Since these medications are gastric irritants, so patient might have or might experience gastrointestinal ulcer. We also have recent surgeries. Since this promotes bleeding, so we would not give this to patients who had just had their surgeries. Intrauterine device placement, indwelling catheter. Okay, so we would not give or perform insertion of indwelling catheter because patient will be prone to trauma, and if the patient is prone to trauma, he or she would also be prone to bleed. We also have heart failure, thyrotoxicosis, diarrhea, pregnancy, and lactation. So these are the contraindications and cautions in giving your anticoagulants. Now let's proceed to your adverse effects. Loss of hair, bruising, We also have chills, fever. Patient might develop osteoporosis and suppression of your renal function. Now let's proceed to your thrombolytic agents. It breaks down the thrombus that has been formed by stimulating the plasmin system or clot resolution. Examples are your altipase or activase, retipase, retavase, urokinase, and abokinase. So the therapeutic action and indications of this medication is it breaks down fibrin threads and dissolves any formed clot. So take note that your thrombolytics actually dissolves the clot. Okay? So as compared to anticoagulant, which inhibits the further formation of the clot, which means the original form of the clot is still there, here in your thrombolytics, it actually completely dissolves the formed clot. Okay? We also have your contraindications and cautions. First, we have your allergy, recent surgery, active internal bleeding, cerebrovascular accident. We also have rupture of blood vessels, aneurysm, obstetric delivery, biopsy, CPR, trauma, pregnancy, and lactations. So basically, if you have noted or if you have assessed your patient to be prone to bleeding, so you would not give this medication. We also have your adverse effects, headache, angioneurotic edema. So I have here a picture depicting your angioneurotic edema. Hypotension, skin rash. Patient might experience bleeding as an overdose or as an adverse effect. We also have your bleeding difficulties, bronchospasm, pain. We also have fever and anaphylactic shock. So these are the possible adverse effects that your patient might experience. We also have other drugs affecting your clot formation. We have your low molecular weight heparins, adjunctive agents. We also have your hemorrheologic agents. So let's discuss first your low molecular weight heparins. It inhibits the thrombus and clot formation by blocking factors 10A and 2A. We also have your anticoagulant adjunctive therapy. It inhibits the thrombin, blocking the thromboembolic effects. We also have your hemorrheologic agent. These are drugs that can induce hemorrhage. It decreases platelet aggregation and decreases the fibrinogen concentration in the blood. So basically, this medication induces bleeding or hemorrhage. We also have here bleeding disorders. First, we have your bone marrow disorders wherein the platelets are not formed in sufficient quantity to be effective. We also have your hemophilia. It is a genetic lack of clotting factors that leaves the patient vulnerable to excessive bleeding with any injury. So we will discuss on the later slides about hemophilia. We also have your liver disease. It is a the clotting factors and proteins needed for clotting are not produced. So remember, your liver can produce some clotting factors. So if you have liver disease, your liver would not function to produce clotting factors. Now let's have your hemophilia. So it is an X-linked genetic disorder that results in deficiency of coagulation factors. Male patients or males or men are usually affected with this kind of bleeding disorders. Females or women are just carriers of this genetic disorder. We also have factors 8 and 9 deficiencies result in an insufficient production of thrombin. So the problem here in your hemophilia is your clotting factors 8 and 9. And also we can categorize this hemophilia into two. We have your hemophilia A and hemophilia B, or also known as your Christmas disease. So when we say hemophilia A, it makes up 80% of all hemophilias. That means this is a common type of your hemophilia. And it is a classic form, which is due to a deficiency of factor 8 or clotting factor number 8. So that means when there is a lacking or deficiency of factor 8 or clotting factor 8, it's your hemophilia. However, your hemophilia B or your Christmas disease, this is due to a deficiency of factor 9. So it is also called as Christmas disease because the first patient who was diagnosed to have hemophilia B is named, or her name is Christmas. Okay? So that is where they got Christmas disease as the other terms for hemophilia B. We also have your anti-hemophilic agents. So basically, these medications or these agents are used for hemophilia. Replacement factors for the specific clotting factors that are genetically missing in a particular type of hemophilia. So the treatment for your hemophilia is basically a replacement therapy. Okay? So if in your hemophilia A lacks clotting factors 8, so we will infuse or we will give the patient clotting factor 8. Okay? So basically it's a replacement therapy. For the therapeutic action indication, it replaces clotting factors that are either genetically missing or low in particular type of hemophilia. For the contraindications and cautions, we have allergy, liver disease, pregnancy, and lactation. For the adverse effects, we have your allergic reactions, stinging at injection site, because usually this medication is given parenterally. So we inject the medication to our patient. So it could cause stinging sensation during the injection process. We also have your headache, rash, patient might experience chills and nausea, hepatitis, and AIDS. By the way, your hepatitis and AIDS are possible to be acquired by your patient due to the manner or the route of administration. Since it is given parenterally, so there is an increased incidence or increased probability that our patient could get hepatitis and AIDS if the one who injected that medication was not cautious to infection control. We also have your hemostatic agents. It means it is used to stop the bleeding. It may either be systemic or topical. When we say systemic hemostatic agents, it is used to prevent body-wide or systemic clot breakdown, thus preventing the blood loss. So the action of your systemic hemostatic agents are mainly a body-wide or systemic affectation. That means it acts throughout the body. But when we say topical hemostatic agents, the local use on active bleeding sites, often during surgery or with severe injury. So basically, it gives you a topical or a localized effects. For example, if you have a cut on your forearms, so we could apply some topical hemostatic agents there because it's just a localized injury or damage to your skin. And also, we expect a localized effect as well. We also have the adverse effects. We have your dizziness. Patients might experience tinnitus, which means there is a ringing of the ear. We also have tinnitus, weakness, hypotension, nausea, cramps, patient might experience diarrhea, fertility problems as well, and malaise. So these are the possible adverse effects that the patient can or could experience in taking this medication. Now let's proceed to your drugs used to treat anemias. First, let's define what is anemia. It results from some alteration in erythropoiesis, the process of RBC production which occurs in myeloid tissue of the bone. Also, it is a state of too few RBCs or ineffective RBCs. So this is your anemia. Now let's have your iron deficiency anemia. So it results to insufficient oxygen delivery to the skin. It is usually treated with iron replacement therapy. So since your iron is deficient here or is lacking here, so all we have to do is to replace that iron elements. We also have your megaloblastic anemias. It results from insufficient amounts of folic acid or vitamin B12 to adequately create the stromal structure needed in a healthy RBC. So as you notice, when we say megaloblastic, that means it's a large or big red blood cells. So here, if you would see in the microscope or if you would examine the red blood cells of your patient, it is abnormally large. Okay, so if it is abnormally large, that means it decreases its oxygen carrying capacity. So that means it would not deliver the sufficient oxygen to the different parts of the body. So that would be a problem in your oxygenation. We also have your folic acid deficiency, which is a type of megaloblastic anemia. Folic acid is essential for cell division in all types of tissue. It is treated by the administration of folic acid or folate. So remember that your folic acid is responsible for the cell division of your red blood cells. So if the patient has a lacking folic acid in her body, so that would also affect the function and structures of the red blood cells, thus decreasing the amounts of oxygen delivered to the different parts of the body. We also have your vitamin B12 deficiency, which is also type of a megaloblastic anemia. So vitamin B12 is used in minute amounts by the body and is stored for us for use if dietary intake falls. It is needed for the formation and maintenance of myelin sheath in the central nervous system. So basically, your vitamin B12 is very essential in your nerve processes. We also have a condition called pernicious anemia. It occurs when the gastric mucosa cannot produce intrinsic factors and vitamin B12 cannot be absorbed. So in your pernicious anemia, the problem here is in your gastrointestinal tract, okay, which cannot produce intrinsic factor, which is very essential in absorbing your vitamin B12. So if your patient would take vitamin B12 as a replacement therapy, and your stomach would your stomach is the main area or is the main area of absorbing this vitamin B12. However, it does not have that intrinsic factor. So that means this vitamin B12 cannot be absorbed inside the body. So it will just be eliminated through urine, through urination or defecation. We also have your sickle cell anemia. It is a chronic hemolytic anemia that occurs almost exclusively in African Americans. It is characterized by a genetically inherited hemoglobin S, which gives the RBCs a sickle-shaped appearance. So as you can see here in the picture, in sickle cell anemia, the red blood cell here is like a half moon structure. Okay, So also it is called sickle cell anemia because it resembles the sickle equipment that we use usually in gardening and farming. And also, if this is the shape or the structure of your RBC, this would be an ineffective RBC, okay? Because it decreases its oxygen carrying capacity to deliver the oxygen throughout the body. Now we have drug classifications on drugs used to treat anemias. First, we have your erythropoiesis-stimulating agents. We also have your agents used for iron deficiency anemia. Also, we have agents for megaloblastic anemias and agents for sickle cell anemia. First, let's have erythropoiesis-stimulating agents. It is used when patients are no longer able to produce enough erythropoietin in the kidneys. Should have adequate component required to produce RBC when using this agent. Example is your epoietin alpha or your epogen procrete, darbenpoietin alpha or RNS. So for the therapeutic actions and indications of this medication or drug classification, we have it stimulates the production of RBCs in the bone marrow. It is also indicated in the treatment of anemia associated with renal failure and for patients on dialysis, AIDS therapy, and chemotherapy. So basically, this drug classification is has a stimulating effect on the production of your RBC in the bone marrow. We also have your contraindications and cautions. First, we have your uncontrolled hypertension. So it is very important that before we give this medication to our patient, we should check the blood pressure because we will withhold this medication if the patient has hypertension. Hypersensitivity to drugs, lactation, and pregnancy. So these are the following conditions that we should assess or that we should take note before administering this medication. We also have adverse effects. First, the patient might experience headache, arthralgias or pain on the joints. We also have fatigue, asthenia, and extreme weakness. Patient might experience dizziness, hypertension, edema, chest pain, nausea, vomiting, and diarrhea. So these are the following adverse effects that our patient might experience. We also have agents used for iron deficiency anemia. So examples are your ferrous aspartate, Fe aspartate, ferrous fumarate, Feostat. We also have ferrous sulfate, Feosol, iron dextran, Infed, iron sucrose, Venofer. So it's very easy to identify these medication because you would see the iron name on the drug name. Also, you could see the element name of iron, which is ferrous, on the drug name. So it's very easy to really identify these medications. We also have therapeutic actions and indications. First, this is indicated for treatment of iron deficiency anemias, adjunctive therapy in erythropoiesis-stimulating drugs. So it is a very important medication if you are administering erythropoiesis-stimulating hormones. It adds up to the therapeutic effects of your erythropoiesis-stimulating hormones to make it more effective. We also have here, it elevates the serum iron concentration. So when you see serum on the word or in the statement, it means that it is in reference to the blood. Okay? So that means it elevates the iron concentration in the blood. We also have contraindications and cautions. First, if the patient is allergic to iron, we will not give this medication. Hemochromatosis, hemolytic anemia. By the way, your hemochromatosis, this is your excessive iron in the blood, okay? That means excessive iron in the blood. So if there is too much or excessive iron, so we will not give your iron supplements or iron medications. We also have peptic ulcers, colitis, and regional enteritis, okay? We also have here adverse effects: gastrointestinal upset, anorexia, nausea, vomiting. Patient might also experience constipation, and this is a common side effect of your iron supplements, okay, or iron medication. So patient might experience constipation. That is why we have to instruct the patient to increase fluid intake to prevent constipation. Diarrhea and CNS or central nervous system toxicity, okay? Because if there is too much iron in the body, it could be toxic to our nerves. We have here agents for megaloblastic anemia. Folic acid and vitamin B12 are essential for cell growth and division and for the production of a strong stroma in RBCs. So as what I have mentioned in my earlier slides, folic acids and vitamin B12 are very important in the structural integrity of the red blood cells. We also have agents for sickle cell anemia. Sickle cell anemia patients are treated with antibiotics to help fight the infection. It helps alleviate the pain associated with the anoxia to tissue. Now we have your hydroxyurea. It is an anti-neoplastic drug useful in reducing the painful crisis and need for blood transfusions in adults with sickle cell anemia. It is associated with many adverse effects because it is a cytotoxic drug. I believe this is the end of our discussion on cardiovascular system drugs. If you have any questions or if you want to clarify some gray areas with regard to our 4 lecture videos about cardiovascular system drugs, please comment down below. I'll be glad to read your comments and answer your questions. Also, if you want to suggest any topic or content for our next videos, please write them below. And if you find this YouTube channel useful, please click the subscribe button and hit the notification bell to keep you updated for new video uploads. Please do not forget to check the description box below for additional inputs and some clarifications with regard to this lecture video. This has been Crazy Nurse RN Hub. Thank you and have a good day.